Welcome to Channel EMEC, your insight to the Australian visa system. Good day everyone, my name is Carl Young, your online YouTube visa consultant. Are you interested about migrating to Australia? Why don't you consider to subscribe to my channel and turn on the bell on the side, so once we have all the updates and news, you'll be the first one getting all the insight. Now today's video is all about medical examination. So obviously any type of visa you wanted to apply for, there is a clause that require all the applicant to actually pass the medical requirement. It's not a very favorite topic to be talked about, but I do constantly occasionally getting inquiries in regards to whether or not my condition or my health condition will actually meet the requirement. And obviously we have just gone through a 24-month plus of the period of lockdown and COVID-19 era, so why don't we have a review of the medical examination criteria for all the visa applicants to make sure that you meet the requirements. Obviously if you're healthy, you probably will meet the requirement 99% of them, but there are still 1% of people may have concern, especially when you're looking to sponsor elderly, your family into Australia. Perhaps they have some chronic diseases, or during their past they have contracted some sort of viruses previously. So we're going to go into examining the actual regulation and law, and go into a little bit of detail, and then at the end of this video we'll go back to the brief message that the immigration webpage has actually provide for the public. So let's go into the nitty-gritty first. So let's do the hard thing first, and at the end I'll provide the summaries as usual how I ended with the video. Okay, so now this one is, now it's a legend come, it's a dictionary or database of immigration law. It's not accessible for public. You need to pay for the service, so it's all a law. You can see a lot of words in there. It doesn't entice anyone to actually read them, but I'm gonna go in there and have a read and digest this information for you and all the viewers to understand. So this law comes from Schedule 4007, usually called PIC, Public Interest Criteria. So 4007 and I think 4005 is the same. They are all concerned about medical. So it's been put into different provision of whatever the visa they look for, but they are basically, I think they're the same. It's just the treatment on permanent and temporary visa is a little bit different, but the overarching idea is the same. So let's have a good read about it. So number one, the applicant, if the applicant is a class of person specified by the minister in the instrument. Now let's jump in there and have a look at the instrument of writing. It's I think it's redundant. It doesn't really require this, but let's have a look. I think it's on this one here. Okay, now I might need to remove myself from this page because that's gonna cover all the stuff. So you can see it's actually it was cited by Scott Morrison, now previous former prime minister. Now he was the immigration minister back in 2014. Wow, interesting, isn't it? Okay, let's have a look. It basically says the following tables of countries required to go through medical examination for visa purposes, and as you can see it basically covers every country. So even USA, UK, you name it, whatever the country they're from, Samoa, Mongolia, Russia, Hong Kong, Japan, so all the countries in there. So my question on this one is, well, if every country is in there, why bother putting this specified instrument? Right? I don't understand. Probably there are some countries not in there, but I've tried to type the country that I know of, so like France, United States, America, it's all in there. So anyway, if they are required to go through medical examination, well then most of the country in this earth that we're living in is supposed to go through all the medical examination anyway. Okay, let's go back to the nitty-gritty law. So if you're from those countries, that means if you are citizen of the world, must undertake medical assessment and must assess by specified person, instrument, and medical officer of the Commonwealth, comply with requests of Commonwealth. So that means if you have you've been diagnosed with special illness or disease, now we're going to take a little bit of detailed look in those ones. For example, tuberculosis and also the hepatitis and HIV. These are the well-known diseases or illness that we have been approached of. So this obviously goes on to application for permanent visa and also for temporary visa as well. So there's not really differences. Now there is a specified provision for protection visa applicant. I'm not going to go through that one because that's for refugee people. So these people, they may have been fleeing from whatever it is, for example war, so they cannot access to medical examinations, and during the period of their fleeing they may be contracted with different type of illness or viruses. We don't know, so I'm not going to go into that one specifically because that's very unique and it's actually being examined case by case. So what I'm going to do is move on next with the special provision of criteria, health criteria, refer to medical office. So if you do have history of, for example, HIV, TB, tuberculosis, and the hepatitis and things like that, you are generally being referred to what they call medical officer of the Commonwealth. So it's another doctor, another panel doctor. They are there to examine what if Australia grants you the visa and there is a significant cost involved if you do have those kind of disease or illness bringing into the country, and if that's going to be too significant, your visa is likely to be rejected. So that's basically what it actually meant for. So a lot of people is worry about some chronic diseases, for example diabetes, heart disease, and some people even had cancer. Would that actually jeopardize their visa application? Generally, if the disease or illness does not contract a significant amount of cost, medical cost, then you'll be fine. Or perhaps you have already spent those significant costs back home, and your disease has been treated already, then obviously you'll be fine. Your visa will be fine as well. We'll look into that later of this video. So let's have a look at where are we now. So what we're gonna do is I'm gonna take you into the actual policy. So the policy here we go. Okay, now I know it's very tiny because the content is just too much. I don't expect anyone to actually maximize or magnify and have read all these details. I'm gonna do the summary for you so you don't have to go through that, but I'm basically showing you that there is a provision there for the to follow the immigration regulations. So okay, so we are at the topic. This is within the medical examination provision under the PIC 4005 and 4007 with the policy procedures followed by immigration officer. That's the case officer who is going to assess your visa application. So there is actual section here says significant cost. Let's have a good read about this. So MOC, that's the medical officer of the Commonwealth, must provide opinion of the applicant's condition of disease who are likely to result healthcare for and the community service cost if the visa were to be granted. That's exactly what I have just mentioned and said about it. So they don't want the potential visa applicant coming into the community of Australia and attract a lot of costs that is gonna that just doesn't suit the criteria for this purposes. Now we are in 2022. It's very unlikely nowadays that any applicant will actually be in this situation unless you're actually coming from third world. But look, a third world is no longer a third world anymore nowadays. A lot of places has been advanced into a modern world already. So let's have a look. So as of 1st of September 2020, policy threshold level of cost regard as significant will be Australian dollar 51,000. So as long as your disease and your health condition will gonna attract any kind of cost more than 51,000, now that's a lot. That will consider to be a significant cost, and it's likely to attract visa rejections. So that's very unlikely. That's very unlikely to go on this one, especially we're in 2022. So for temporary visa applicants, estimate cost of period proposed stay in Australia is assessed over a period of stay. The visa officer intend to grant the visa, for example, student visa with health cost of 16,000, who will be granted 1 year should be found meet the health requirement. On the other hand, if the student visa with a cost of 16,000 a year, who will be granted for a full year, that will not meet the health requirement. That's like the total, you know. If the condition is gonna cost so 16,000 times 4, that's 64,000. That's more than 51,000, right? Because that's the student's gonna stay for 4 years. Then you will likely fail. Sorry, I've myself actually covered that. So I was going through this document, a sample here. Now, for permanent visa holders, a period estimated health and the community services cost against the significant cost threshold is 51,000. It's calculated as follow. They're giving you a sample here. If applicant is aged less than 75 years, a 5-year period, so they will calculate how much is going to spend on this person per year and times 5. If the applicant is age 75 or older, they will calculate 3-year period, so times 3. So they give a little bit of incentive. But obviously, if you're over 75, you are required to pay for the contributory parent visa thing. That's additional visa cost, roughly altogether about 60,000, and that's why it's less period required to go there. So unless the applicant has a condition is permanent and the cause of decision inevitable, reasonable, predictable, beyond 5-year period, in the circumstances the applicant will be assessed a maximum of 10 years. So this is very extreme. I'm not going to go into those details because that's really case by case. So let's have a look. There's a little table here, summarize what we just gone through, how many years is going to cost and be calculated in there. Prejudice to access, the MOC must also assess the applicant the condition and disease will likely to prejudice access of healthcare and community services in the visa once granted. So that's, I think that's just basically that's an estimation or prediction or potentially what's gonna come up. So for example, organ transplant and dialysis, which, well, it's still case by case, not likely nowadays, not likely, because every corner of the world is moving towards modern world. If you're looking at the so-called third world back in 10 or 20 years ago, perhaps Southeast Asia was, but I don't, no longer, but some part of those countries are still like that. In some part, for example, in Europe and even USA, still like that. So it really depends. But if you're coming from the large cities, modern cities, it's unlikely, especially for visa applicants. We don't see people coming from a region, countryside regions, or really outback regions of other countries, because they don't generally access to visa applications. Well, it's likely, but unlikely in a way anyway. So there's also a thing they call applicant unlikely to return home. As we are in a modern world nowadays, generally any countries nowadays provide the citizens' healthcare funds and whatever. So they'll also assess how that country's the national healthcare scheme or whatever it is or policy could be accessible for this citizen. So for this applicant. So if they can access something back home, back their originated home countries, then that can be subsidized as well. So it's actually very good. So a lot of people coming from Asia, they do access to additional healthcare fund or the government fund, whichever the country they're coming from, or Europe. So that will be deducted as well. And that's why I'm saying I haven't really seen anyone fail public interest criteria PIC 4007 or 455 nowadays. And how respondent requests an MOC cost breakdown. So this is detail of how the medical officer of Commonwealth will actually break things down. Now, I'm going to go into those detail, but I am going to take a look at the public health risk and then polio here, which is, that was the last page I'm going to show you, but it's very brief. But this page actually shows you numbers of different diseases, and there's exemptions. So exemption usually only go for the 155 visas, temporary work, special categories for all the Kiwi or the New Zealand citizens coming abroad, and transit visa. Of course, you only transit. You're not gonna even enter into Australia. So maritime crew. So you're the pilots, or the flight crews. Diplomatic visa. That's for all the political people coming through here. The tourists, so that's all exempt. And vaccination certificate, obviously we just gone through pandemic COVID-19, so make sure you have the certificate of COVID-19 vaccination certificates, or you may have some sort of waiver medical paper or statement from your doctor saying that you are exempt to actually do it. Perhaps you already contracted and recover. You don't need to do that. So there's a lot more detail about tuberculosis and also hepatitis, yellow fevers, and also HIV and things like that. It's in very, very detail. I do not plan to go through those details, but let's look into the actual last page, which I had just accidentally jumped in there previously. So this page you can actually access publicly by typing Home Affairs and space threats to the public health, and you should be able to find yourself. Google should be able to assist you to find this page here. It actually points out numbers of diseases that may potentially got your visa rejected, so you may have a good look at this. So for example, measles, Australian government does not currently require evidence of measles vaccination status. However, measles vaccination is strongly recommended. So again, because we're in 2022, a modern world, a lot of these things has been treated, and thanks for the World Health Organization for the past decades of work. Tuberculosis, so declare that tuberculosis is an epidemic and a global emergency. Permanent visa applicant will be tested, part of visa application process. Temporary visa applicant might be asked to get tested. So if you have active tuberculosis, is the most infectious form of disease and is greatest threat to public health, we are most likely to test you for active. So if it's inactive, then you're fine. I haven't seen anyone with active tuberculosis nowadays. They may have contracted years and years ago, and there were scars in their lung. I've seen those report, and they pass the medical examination. Visa applicant age 11 or older must go through X-ray. So that's exactly what you do when you're required to go through visa process. You always get an X-ray. So that's exactly what they're looking for, evidence of tuberculosis there. Advisory international student. Some international students are much likely to develop TB than people born in Australia, likely to have much higher particular. So anyway, you gotta go through X-ray as what we have previously read here. Okay, now HIV. Now there are people with HIV and hepatitis. Hepatitis is a disease on your liver. There's a lot of people may have them, but most of my clients, well, all of them, to be honest, had hepatitis B or C, all passed the medical examination because we're in a sufficient and modern world. It can be treated. So let's have you must have an HIV test. So that's a blood test that you're required to go through. You must have hepatitis if you are anyway. So anyone going through permanent resident application will require. So that you go permanent visa, and you will require to go through test of blood. So you go to medical examination, and they will just with a syringe and take some of the blood for testing purpose. So evidence of HIV. Now we generally don't. So this is the government of Australia. This is very important. We generally don't consider HIV and hepatitis to be a threat of public health. But if you have HIV or hepatitis and you apply for temporary visa, you might consider the threat of public health if you intend to work as a doctor, nurse, or dentist, paramedic in Australia. So in other words, if you intended to be working in a medical condition, with this medical condition, then you probably will fail this criteria. So otherwise you will only be assessed by MOC to determine whether a condition would result again in significant healthcare and community service costs. That's what we just gone through. So I don't think hepatitis or HIV now they will cost 51,000 Australian dollars. So that's very unlikely. So that means you will pass. Prejudices access to Australian citizen permanent resident service in short supply. So if your hepatitis disease is so bad that you are required to go through a liver transplant, for example, well, that's not possible, because if you're that sick, you probably won't seek migration. You don't have the appetite to migrate anymore. You want to have a good life, wouldn't it? So that's not really gonna happen anyway. Yellow fever strongly encourage people to get international vaccination if you're age and older. Polio is a highly infectious virus, invades nervous system, so invade your brain. Okay, so no, not the nerve system. So brain and your or your embraces. So vaccination coverage of polio in Australia is high. I don't think that's possibly Ebola. That's something came out from Africa back in 2015. So it's not likely in the modern world nowadays we'll have Ebola viruses around. It was in South Korea, but I don't think there's gonna be there anymore. Anyway, that's for the video today. So you've learned about how you might pass or you might not pass medical criteria of the Australian visa criteria conditions. However, as I said, we're in 2022, a modern world. There is no really a third world out there, but there are some regions, a poor region within any country nowadays. But those people don't tend to access to migration purpose anyway. Not saying it's not impossible, but the possibility is very low. So from almost 20 years of practice, I haven't really seen anyone fail or get rejected in these conditions. But if you're coming on board with a family, the whole family, if someone failed this condition within that family application, the whole application will fail, will deem to be fail. So it's actually very important to keep yourself healthy and happy. Anyway, should you have more question, query, more than welcome to leave a comment right down below. And I'll see you next video. Goodbye.